Our first speaker will be Michael Parkinson. And just a very short introduction. Michael brings experience and some expertise in multi-sectoral human systems engagement, design, and policy planning to advance cost-effective solutions that improve health and safety for both individuals and communities. Michael was most recently employed at the renowned Waterloo Region Crime Prevention Council until it was defunded in 2022, where he advanced issues of upstream prevention, community safety initiatives, and a plethora of life-saving drug strategies, programs, laws, and policies at national, provincial, and municipal levels. And I can say, before this last election, I didn't really know Michael Parkinson, but I've come to know him a lot since, and I've come to become quite impressed at his level of knowledge and the experience that he brings. And so, Michael, I'm just going to turn it over to you, and please run with it.
Thank you to all the people who are joining us tonight on what looks like a lovely summer evening. And thanks for the kind introduction. I'm just going to run through some slides fairly quickly here, and hang on to your hat because I have too many slides, and it's a habit. What I aim to do tonight is very quickly talk about the tragedy in drug poisoning, and central premise will be that things are so dire that really we're looking for population level improvements, and the farther upstream the better, for sure, but certainly that includes structural issues. And I would argue that largely for the entire time of this crisis, and got to remember, it'll be 10 years ago this month that probably the first advisory on the bootleg fentanyls was issued here in Waterloo Region by myself and the Peterborough Police Service, warning of the threat to public health and safety. And I know I'm not the only one here who has watched a largely preventable crisis unfold. Part of the reason it has unfolded in such a tragic manner is really there are no adults in charge at any level of government, and really there's a real absence of strategies in the traditional sense of the word. So we don't see a strategy that is urgent to the scale of the crisis, that is proportional to the scale of the crisis, with targets. You know, do we plan to get to 0 overdoses or 50% less overdoses, with timelines, and certainly with the deployment of resources necessarily to scale to tackle the crisis. And so we sort of work around the edges. On your left side there, I mean, despite the best efforts and a lot of hard work, we're sort of nibbling around the edges of a full-scale population level tragedy that is literally affecting and driving down life expectancy in Canada. So I sometimes think of drug-related issues as one of supply and demand, you know, invoke some of that economic language. And I want to take a look quickly at the demand side, or the prevention side of things. And, you know, if we're looking at what determines our health, well, very little is related to genetics. Much more is related to the social determinants of health. And these are all protective factors against problematic substance use, but also health issues that would prevent people from seeking emergency medical care, for example, that would prevent people from becoming homeless, would enable people to join the labor market, et cetera, et cetera. So they're commonly called the social determinants of health, and they look a lot like the social determinants of justice, that the farther out you are on this ring, addressing those kinds of issues on a population level, on a systemic level, the much better outcomes you will have, not just in drug-related issues, but for a whole host of other factors. I'll note here that this slide, it's out of Australia fairly recently, it mentions early police contact. And because certain drugs are criminalized, there is a lot of police contact, and I'm not throwing shade on the police in particular, or the criminal justice system in particular, but we know it is a risk factor. And so on the demand side, you know, we want to prevent. And on the left here, you'll see that you've got physical care, you've got housing, you've got education, you've got substance use on the far left. And if we're nibbling around the edges, we might make some progress. But the farther upstream we go toward the center, the much better outcomes we'll have. And so we're not just talking about addressing problematic substance use, but those whole host of other indicators of health, safety, and well-being. And at the deep upstream level, I suggest to you that this is one of culture and politics. And on the right, at least from the Western point of view, Rudolph Virtue said, so many years ago that medicine is a social science and politics is nothing but medicine in a large scale. And this crisis has become hyper political to the present day, and it stretches back more than a century. And that's unfortunate because, as we've learned from the first SARS epidemic and the way we deal with other public health threats, it's ideal to keep some of the politics out of it and stick to the science, the evidence-informed, the evidence-based approaches. And so we have lots of examples of failure. I don't want to go on and on. This is from Mount Sinai Hospital in New York State. And they run a hospital, but they also run a pretty decent social determinants of health type program. But the same would be true of our correctional facility. If we're filling those beds in hospitals and jails with people, it's a symptom of failure. It is not a symptom of success. And I'm going to draw on some local research here. This is called the Unsafe Study. And not to stigmatize people who use drugs, because most people who use drugs, unregulated drugs, are probably not committing crimes. But we spoke to 42 people who lacked stable housing and we're using unregulated drugs regularly. So probably at the point of addiction. 95% have been in and out of jail as an adult. The average number of times was 12. The back of napkin math for a really conservative provincial sentence is more than $1 million per person. With really questionable benefits, because what's happening here is a cycle in and out of jail and right back to where you started. When we look at overdose deaths, another clear symptom of harm, we know that by and large, most are accidental, upwards of 95%, most are preventable, et cetera, et cetera. And I draw your attention to the top right here. In just the first 4 months of this year alone, we've lost more than 1,000 people in Ontario. That is a full-blown tragedy. I'll point out here that in the fourth quarter of last year, we think about 68% of those deaths were related to smoking and inhalation. And it's a good example of the politicization of evidence-based measures, where if we had consumption sites where they were needed, they would include inhalation facilities. We really don't in Ontario, except for one private hospital. Looking locally, I just want to draw your attention to drug poisoning deaths on the bottom right. It's 626 just since 2018. Opioids, of course, are the primary substance, and those are the bootleg fentanyls that we warned about almost 10 years ago. So it's off the charts when we compare to other important but less common forms of death and injury. And by any measure, it meets the general definition of a public health emergency. It's not a question if people are going to die this year in large numbers. And it's certainly not a question that at the local level, we are overwhelmed by the scale of the crisis. The protocols exist. This is, well, a bit dated, but it's from the Ministry of Health and Long-Term Care, but they are not being applied to this crisis in the same way we would to uncriminalized issues, listeria in your lettuce, salmonella in your chicken, or the way we've worked so hard to make Ontario one of the safest driving jurisdictions in the world, with a clear vision, clear structural reforms when needed, and clear funding. We're not there yet, but we're on the way. And of course, there's a range of other harms, and my interest is really just good public service. So deaths, yes, let's drive that down to zero, but there's a financial impact of not getting serious about this crisis. And in Ontario, in 2020, we estimate, the Canada Centre on Substance Use estimates that for all substances, so not just unregulated and illegal substances, we're looking at north of $1,200 per year, per person. So drawing again to structural stigma, this whole slide is really from Health Canada, but they do a good job in pointing out that structural stigma and discrimination is real. And I just want to draw your attention on the supply side of things here. The first real act of prohibition in Canada was the Indian Act of 1876. It's so atrocious, I won't go into any detail. Following that was the Opium Act of 1908, and wasn't based in evidence, it was based in racism. About 8 years later, we attempted alcohol prohibition, and Waterloo is no stranger to that. We benefited from that, particularly during US alcohol prohibition. And this was the flavor of the times, help me keep our children pure, drug-free, all that kind of stuff. And drawn on a local councillor from almost 100 years ago, W.G. Michael, said the Ontario Temperance Act, this experiment with alcohol prohibition, was a failure. That we were missing out on tax revenue, as we are today, with a multi-billion-dollar unregulated industry. Crime increased at the trafficking level for sure, and people who wanted alcohol were finding ways to get it, and there was an unregulated supply that popped up, and we saw alcohol poisonings explode. We saw homicides explode, particularly in Chicago area. And importantly, Mr. Michael said that legislation should not be based on emotion, but really should be based on good evidence. Fast forward to almost a century later, last year, the chief coroner of British Columbia is saying essentially the same thing, that the laws of governing supply and the prohibition essentially is doing more harm than good. And it's not the only one to weigh in. This is from the journal Pediatrics, that pointing out that it's not just about overdose deaths, but it's about impacts on children and youth and families. So to summarize, if you don't know where you're going, pretty much any road will get you there. And we still, to this day, lack a really coherent strategy at all levels of government. And when the Crime Prevention Council was facilitating the development of the original drug strategy here, this was some of the rationale. I pulled this slide from the archives. This was some of the rationale that was used at the time, that revolving door, science and ideology clashing, et cetera, et cetera. So it is my hope that one day we get together and develop a strategy. And as we've learned that it's so critical because the political contamination of science and strategies is a real thing, that any strategy that's developed is firmly based in community. Yes, you want those big partners, those big agencies, those government agencies around the table, but they cannot drive the bus because it is political. And if I could leave you with one thing, it's one of my favorite mottos. It's from the Chief Coroner's Office of Ontario. We speak for the dead to protect the living. And I hope all of you will become advocates today, tomorrow, and in the future for a real strategy that will protect both individual and community health and safety. So thank you so much for your time and attention.
Michael, thank you very much for that. And look, I just want to just ask a couple of questions. First, I want to touch on the hyper-political that you referenced, and we're starting to see elements of that right now in a question period federally. The concept of safe supply seems to be something that people are batting around on either side of the political spectrum. It's almost an intellect versus emotional type argument. So how do we get around that? What can we do with respect to something like that?
Well, you're right, and not just in the House of Commons, but what Councillor Deutschmann is talking about is a motion that was introduced by a political party that was doomed to fail, and I'm not convinced that it wasn't based in any evidence. It was about changing the culture and changing the narrative to one that stigmatizes and villainizes people who use substances, and families, friends, and others affected. And we've seen this before. I mean, in some of those slides I showed from a century ago, and we've seen it, just a couple of decades ago. And it might work it might get you elected. And you know, I talked really quickly about that deep upstream and culture. And to your question about, you know, what to do, speak out. You know, all of us end up in meetings or in conversations, whether they're formal or informal. There's a real risk here, and I don't want to be too depressing about it, but when we think about how culture has changed by politics, I mean, politics, I think, is probably influenced by culture, and culture influences politics. And we look at what's happened in to the south of us, where, you know, there's so many lies and it becomes normalized, and I think we just start to accept it, that this is the new normal. And there's a real risk here in the broader scheme of things, you know, and that will affect, you know, those structural determinants of health, structural determinants of justice, not just for people who use drugs, but for all of our well-being. And that is the shift to authoritarian type governments. I mean, that is underway in Europe. I think it's underway in the USA. And so what do you do? I mean, I'm not an expert in that particular field, but I think we need to continue to speak out, and particularly support those in, you know, whether it's public health or elected officials or policing, criminal justice, because sometimes they are hampered by the politicization of their area of expertise, and will benefit from those voices who can offer a perspective and offer a voice that is not always politically palatable in some of those institutions and in culture more generally.
Well,
but yes, I'm worried. We expect more of it, unfortunately.
yeah, and one of the things, we won't get into it now, but I mean, we're starting to see now governments, for example, it's almost like a philosophy, forced treatment, for example, which you're starting to hear out of Alberta. You know, decriminalization in BC. There's a lot of different things going on here, and I guess we'll have to watch and see. And I guess out of all of this too, people will start to wonder, we're not going to talk about this now, but who drives this process? Because I know community-led is a strong concept for you, and it was certainly a strong concept in Waterloo Region in terms of seeing change. So anyway, we'll get back to that, and later on, maybe you can I'll come back to you and ask you what is meant by upstream, and so maybe we can get a better definition, a communal definition on what upstream would mean.